Who wants to chair today?
Boss man can.
Approve it. You got the roll call. So,
Yeah.
and then you got the agenda, you're gonna approve it?
Yep.
Yeah. All right, who's second that? Public comment? No. Unfinished business? We're good. Let's go new business.
Laura's got a thing for you today.
Hi, there's a summary in the packet. Basically, this is a line of funding that came through our Area Agencies on Aging Association. They wrote a grant to another state level agency that is kind of. Oh, you didn't?
It's right here. Right after page 1. Flip your
Oh,
agenda.
Oh,
it's
flip
on
your
the back.
agenda.
yeah.
I was just
It's
acting
on the
like I
back of your agenda.
was
No, the other page. It says
Well,
page-
listen,
There
Okay.
it is.
Double sided.
So for the
I always forget the double
We're trying to
sided.
save it trade here.
So for the last couple of years, the state's been working really hard on direct care workers and efforts for training, retention, elevating the importance of these direct care workers in our aging network. And so this alliance called Impart Alliance, which has professionals out of the Michigan State University, as well as Wayne State, a couple of other network partners. And they've really been focusing on research and education campaigns and training. They've developed a lot of neat trainings for direct care workers and certification programs. And so they wrote a grant with some of the special ARPA money that came out in the last couple of years. And our association was awarded a grant to kind of help workers that are in a pinch with unplanned expenses that hit them that might keep them from reporting to work. So a flat tire, childcare costs, food insecurities, all sorts of different things that kind of keep somebody at home rather than out on the job. And so this DCW help program is intended to support some urgent needs for some just unplanned expenses that they would run into. So like medical expenses, say they had to take their little one to the ER. Deductibles for ER visits are not cheap. Housing crisis, critical repairs to like heating, water, like all the utilities at a home. They get back, behind on their bills. A car battery, a tire repair or replacement, those types of things. And so the state our association put out these mini grants and gave us 10 grand in March. And we kind of held off because we were implementing the, as you know, the My Options program and trying to hire, and it was a wild time. So we held off, and boy, am I glad we did. I knew we were going to have extra time. So we knew we'd be able to get it out. It just wasn't the right time. I'm really glad we didn't, because now we got another $10,000 coming, and we wanted to now put it through because they've enhanced the flexibility with these funds. So there was a different process earlier on. Now they've made that more flexible, and we can sort of award this out and pass this through basically to any one of our providers that employs direct care workers that serve our clients in Branch County or in St. Joseph County. So we have a list, both of our COAs are on it, that are eligible for these funds, that have aides that would maybe go to their in-home services supervisor and say, I cannot come to work because I don't have a backup daycare. The only other one, they want an extra $100 because it's last minute. Well, let's talk about that. Let's get you here to work, and we will pay the $100 that's going to cost you extra.
So can you spend $20,000 by March?
Yes, sir, I can. Yes.
When I
So-
was reading this weekend, I'm thinking like, research that.
Yeah. Well, we could easily see gift cards for Meyer, because that would help with any number of unplanned needs, whether it's food or clothing for their kids that, maybe they, need hats and gloves, or they need a pair of boots because their kids' feet are growing so fast. So between the two Commission on Aging offices, they're the ones that employ the most direct care workers out of all the people that we work with. Then we have 4 home care agencies, privately owned home care agencies that we do business with, that serve clients in our community living program. and they have a few aides in each of those organizations too. We're waiting to hear back from them on how many aides they do have that serve our clients. And once we do, we'll be able to divide out the funding equitably. But we're thinking right around between $200 and $500 per direct care worker that they would have access to if they need it.
So you're just gonna give them the money, not wait for them to have a disaster and say,
That's correct.
and then what if they still call in and say, I need $100 for
They would have to.
thing and I spent my $200 to $500 already?
That would be up to the provider. That would be up to the provider. We just ask that they retain all the receipts, and if they can pay the vendor or the person that they're buying the tire from, or they're paying the utility bill to, consumers or BPU, they pay that bill directly or help pay that bill directly. And it's really up to those employers know their staff, and they would know what's legit and what's being what emergency it's helping with.
Well, that's what I could see where the Meyer card, that's only gonna be good for one thing. Where,
They could buy medicine for their kids. They
Yeah.
could buy, anything from medicine to, groceries.
yeah, but I'm talking bills, car payment and, or tire.
Hmm.
Well, I guess you could get a tire at
You could.
Walmart, so, yeah.
Yep.
Whatever you decide, I guess.
Yeah. Well, again, it would
They
be,
decide.
right. It would be, based on some of those parameters that are bulleted in that summary. And we, we would want them to see the bill and see the demonstrated need first before they just, open their petty cash drawer, start handing out.
Pretty brainer, so. Yes. We have to have a motion to accept this grant.
We've already accepted it. We just want the board's input and direction and approval on how we're intending to put it out to our providers, our contract providers.
I would think your idea of just divvying it up at the beginning, and because I guess my thing is one person could eat up quite a lot of this, and then somebody else has a problem. You're like,
Yeah.
Well, 5 other people needed,
And there-
$5,000 and we don't have any money left.
Right. So this methodology just came to be. Early on, it was, show us, let the area agency approve the expense, and you incur the expense first, and then we'll reimburse you. And it was very cumbersome. And at that time, when we were implementing my options grant, I was like, you know what, I'm just gonna wait, put this on the back burner a few months, and it literally just before the holiday came through that we would have this added flexibility. So I like this route much better.
Divvying it up, I think would be,
Based on the
and
number of
then let
direct
them
care
know
workers.
that this is to keep you at work, it's not a pay raise, it's an incentive to come to work.
Yeah, it's because they value them. A lot of the direct care workers are longtime employees. Our COAs especially have very, their longevity of their teams are pretty incredible. So
We'll take this to next meeting for board input, I guess. That's what we're just looking for, right?
yes, please.
We want to
Support it.
We do, maybe, all right. All right, next one we got.
Budget amendment.
Tis the season.
There's a lot to go through on this.
Yeah,
What was the short version?
that's what I started doing. It's like, oh crap.
We have a Cliff Note version, Terese.
The short version is kind of basically on the top of page 4. This budget is made up of a little over $5 million in state and federal funding, $1.2 million of ELPHS funding, just less than $800,000 in county appropriations. We take in about $1.5 million of fees and other. This budget uses $250,000 as fund balance, and it is $21,000 less than the original budget. So a little bit of moving around. Grants came in that we weren't expecting. We got a full picture of what expenses are going to be. So we feel like this is a pretty good representation. And the other thing that is in this budget that is new would be the drawdown of the MERS surplus fund that the board voted on. And you would see that on page 10, right, kind of right in the middle. That's 138,000. That's the very second to the bottom line, right in the middle of the page, where we've applied that 138,000 from the MERS surplus fund.
See, I knew you'd give me the short version. Cause I was scrolling through a lot of stuff, thinking, what does she just want me to know?
So basically, this routine you do every year just to balance everything out and put the money where it needs to be.
Yeah, we make our budget, our first budget is due in like June, and we don't have all the information yet of what grants we're gonna get, whatever. This is usually a pretty close to what we think is going to be. We're gonna end the year, we'll make another budget amendment in May when we have a little bit more data as to how things are performing. But this should be fairly good.
He is, that is 21,000 less than what you're using.
Yeah.
Any questions on that, Kevin?
No, I don't. Make a motion to approve the amended budget.
Rock and roll, employee compensation. Let's play that record.
What's the matter?
Got crayons?
Nose hurt? You need to blow your nose?
Grandpa's in trouble.
Good girl.
I can multitask.
All right. So obviously we've been working really hard here to increase wages because they were pretty stagnant for a number of years. And this board has done really well at moving that needle forward. And we appreciate that. But we feel like there's still more work to do. The biggest issue that I think we're facing right now is the bottom of our scale does not meet the required minimum wage in 2027. We do meet it for 2026. At the current rate, without making any adjustments, we would meet it for 2026. But to bring the bottom of the scale up to where it needs to be for January 1 of 2027, it needs to come up 7.5%. So we are recommending 4% this year. And then if we do 3.5% next year, then we will have the bottom of our scale in compliance with the minimum wage law that goes into effect in 2027. We also feel that we know that's a little bit higher a raise than inflation went up, but we're still a little bit behind. Inflation has gone up 23%, while wages have only increased 18.6%. And if you look at the chart on page 2022, you'll see that all of the second column that has the yellow in it, those positions that are yellow are still below the average from studies that were salary studies that were done in 2023. So we're still lagging a little bit behind, or we feel like we are. And so we are recommending a 4% increase.
I did have a question. Vision and hearing coordinator.
There's not always an exact
That
there's not always an exact comparison job to job from health department to health department because they're definitely broke up differently. And our vision and hearing coordinator also is the children's special health care coordinator and the COLA coordinator. So he does a lot of other things. So
okay.
it's not exactly an apples to
So
apples
that's why
comparison.
I just want like a big pay raise
Yeah, a
from
lot
the
of times
4801 to 40.
I think we should lower it
103.
back.
a lot of times they just have a vision and hearing staff that's elevated to that. Ours is a nurse that is in charge of all these other things.
So does have other, wears other hats. And
She's a supervisor over a number of staff members.
okay. No, I just thought that was kind of weird.
Yeah, sometimes it's hard to compare position to position between health departments because we do have a little bit different work charts.
And the part-time secretary, that just an old hire compared to a new hire. Why it went
Very
down.
last one,
Yeah,
bottom.
yep, very last one.
Yeah, the part we only have one of those, and that's the one that would be on the lowest end of our wage scale.
So she got a pay cut then, or she just got hired?
No, she's been in that position for a number of years, so she's actually towards the top of the scale.
Oh, that's survey. Okay.
Yeah.
Okie doke.
I have no issue with the 4%. County.
Yep, I'll move to the board.
All in favor, hey. Uh-oh, this is the big,
Yeah.
So I already found a typo at the very beginning, so I'm finishing my 10th year of service, not starting. I will have completed 10 years in January, middle of January of 2026. So
that's it.
I'm glad you're going for a 3-year
should be finishing, but anyway, so.
instead of like the doctor with a 1-year.
Yeah. So I am asking for a 3-year contract. I'm asking for another change, and that is a removal of the merit pay piece. It creates an issue with staff because, I have an evaluation and then, if it goes well, I get, this chunk. And nobody around here gets that but me. It is really part of my final compensation package, but that's not how it's viewed by the staff. It's viewed as an inequity and it's a problem. So I don't feel, maybe as a new health officer, when I was brand new, there was a reason for a merit pay like that. But after having finished 10 years of service here, with always good evaluations, I don't see any need for that anymore. And I think it would be a morale boost to staff if that was just flat out removed the way that it's done.
It's always kind of controversial, it's good.
So I'm asking that that be removed. I'm also asking for the 4% that the staff is getting. And I gave you some information there with regards to the average, which we just looked at on the previous page, puts the health officer average at around $62 an hour, which would put that salary at $129 annually. However, I want to point out that the survey doesn't take into account years of service or the complexity of the operation, the population surge, geography, none of that. And in the past 3 years, 29% of 45 health officers are brand new. Just in the last 3 years, there's 45 or 29% of those 45 are brand new positions. So they're going to be starting more at the lower end of the compensation scale, right? So that average is skewed a little bit because of that. Also, I reached out to a couple of health officers that have district health departments like we have here. And so the first district, that health officer, you see his current salary there. They have 4 years of service than me, with a smaller population than we do, larger square miles, and then the other district, fewer years of service, the salary there, smaller than BHSJ, again with population, fewer square miles than BHSJ. So, asking for a 4% is only bringing me up to 122,033, which is still lagging behind the other health officers with similar experience than I have. But I feel a 4% again in solidarity with the staff. We're going to give the staff 4%. I'm asking for the same thing. So
Have no issue. Revamping, changing, and now the second and third year would be based on.
the second
We
and
would
third
look at
year,
your pay.
well, it would, so if the staff in the second year is afforded a percentage, then the health officer would get that as well, just like Dr. Lubarella's contract. Same with the third year.
Is that in your contract?
It is. During the terms of the contract, the health officer shall be granted any percentage increase in pay as approved by the Board of Health for employees of this agency. Yeah.
We didn't have. Correct. That this year. Do you want to move it, Kevin, or you want to
To
argue?
the full board? No,
I'm sure you're. Okay.
And I do appreciate you doing that for the staff.
Oh,
I'm sure the staff will.
Yeah.
Appreciate it.
it's the right thing to do.
All right, and then we got, that went through, so then we got community health improvements, strategic plan, what do we got there?
So the last time we went through strategic planning, we hired Mary Fisher Consulting. We're very pleased with the product that we ended up with from her work with us. So it is time for us to take a look at not just our strategic plan, but also our community health needs assessment, our community health improvement plan, which goes along with that, CHNA, and then finally strategic planning. So I approached Mary and I said, we'd like to do this in this order, start with a needs assessment, move on to the CHIP, and then end with strategic planning. And if we did all that with you, what are we looking at as far as a charge? And so Mary is proposing $19,120 plus travel expenses incurred as we agree to with her. And then she outlines that they're billed at a rate of $160 per hour with travel plus at 50% of the hourly rate. And she outlines the amount of time in here and everything. We would end up with a full slate of the materials that we need to make the decisions on where we should put the dollars that we do get and where we should focus the needs of the agency by the end of 2026. And I think it's really good value for what she's proposing to do for us. So we're asking for your blessing for this contract.
Yeah, right. I'm good with it, we want, Kevin?
Yep.
All right, move forward, all my favorite, hey. And
Is that
you wanna meet in January sometime?
Well, we need a date, I guess. So that's,
And then we reorganize first meeting in January,
yes,
financial stay the same until,
yes. So the board meeting will be the 22nd.
right,
So the finance is usually like at 12.
that would be,
No, I think.
Oh, it'd be the fifth?
It's, finance would be on whatever day Martin Luther King Day is.
Oh, the 19th.
Yeah. And that's when we can't have it.
we're gonna move forward that way, I can make it, that way at least you'll have a report. Jerry can't make it,
Whenever you can.
I think I'm looking to fly out, 14th,
So
16th of January.
I do have a problem with the 12th unless we do it in the afternoon.
That's where I'm at.
With the 12th?
Yep, with the
Afternoon's
12th, I
free.
got a VA meeting at 10 o'clock in Hillsdale.
I'll be on vacation.
What?
Yeah.
Is that, I didn't think that. You wanna do it a different day, or you getting 19th, I just won't be here.
Well, what about the 9th or the 5th? The 5th and
I'm on vacation too.
I'm
I'm on vacation the first 2 weeks of January.
Do you know?
excited.
Well, we can still do
And
it without you,
you
can't
can
you?
absolutely do it without me.
She just wants to be on a boat.
I can't do it the 9th, but the 5th works for me.
Works.
5th, yeah, 5th works, I'd plead the 5th. Yeah.
I would say we stick to 9 o'clock then on the 5th.
January 1, 5.
9 o'clock is perfect. I get to
9
breakfast.
a.m.
We may not, I
Time.
mean, is there a possibility we might cancel that meeting too?
There absolutely is. Right now, I have nothing on the agenda.
But I guess we got basement bill, gotta do something.
Well, we don't bring the bills to you.
Yeah,
just
I'm
meeting.
just thinking that.
So, I mean, we just did the budget amendment. If we get the contract and if we get, as long as we get the health officer contract through December,
Play it by ear.
may not need
If
to
we
be in
don't need it, we
January.
don't need it.
I can't think of anything that I would need at that point,
You're
because we
gonna
have the
be-
budget done.
2 weeks on a boat,
Yeah.
where at?
Caribbean. So,
For the
Barbados.
year. Well, you know, it might be chilly.
yeah, I've been there. It's pretty nice.
She's just gonna be so glad to be out of here.
I'm gonna see.
I did
No
one.
matter what the
I
temperature
did, I
is.
did one. I do get, I got through both the end.
We did one in January and had hurricanes the whole time. The boat was like,
I'll be burning bridges out here. I know.
In January?
yeah,
Oh,
it was near the end of January, 1st of February, or it was in the end of January though.
I was thinking hurricane season was over by now.
Usually this
Man.
typically go in February or March, but we've gone one time before in January. That's not really good deal.
We gotta go on a cruise for our 80th birthday. So we like booked the whole. So like going on a cruise with their 80-year-old birthday, yeah.
Yeah.
So our girl fun will be in bed by 4 o'clock. Oh, I moved to adjourn, by the way.